Hello, everyone, and welcome to the Hope Discovered podcast by CommQuest. My name is Bill. What we do here is we try to provide hope. Our slogan, for lack of a better term here at CommQuest, is Hope Happens Here. And when we are talking about issues with mental health, addiction, central to our message is that recovery is possible. We often have people on the program who will share a personal story, and other times we have people who work in the field, who work in the marketplace of recovery, and we discuss different aspects of that. And today we are going to be talking about same-day assessments, why it is so important for this field, and how we are approaching it here at CommQuest. We offer confidential assessments with expert licensed counselors who work with you to help determine if treatment is needed, what treatment options work best for you, and which of our locations are the most convenient for you and your situation. To discuss this with us is Greta Heatherly. Greta, thank you so much for being on the podcast.
Thank you for having me.
Absolutely. Greta is the clinical site coordinator at Alliance Outpatient. Let's kind of start there. Tell us a little bit about your position at CommQuest and your overall duties.
My primary responsibility as a site coordinator is directly being responsible for the clinical staff, so the counseling staff, as well as working as a support and coordinator for the other services that we offer through the agency as well as our office, which would be our MedSum psychiatric services and our case management services, and also our client engagement services. And it is also my duty to take care of any and all issues that come up on a daily basis.
Yes, we appreciate everything that you do for us. Let's start with talking about what an assessment is. A lot of people may not be familiar with that. They kind of feel they just walk in and get help, but it's a little bit more complex than that. Tell us a little bit about what an assessment is and why they are so important.
So a comprehensive assessment is the first step towards getting to know somebody's life story. And I usually tell clients in an assessment is this is the time when we get to know what is going on in their lives, what challenges there are, different aspects of their lives. So we can make a clinical assessment about what symptoms there are and what treatment would help best with those symptoms. So comprehensive assessment, we call it comprehensive because it assesses for many different things. It assesses somebody's mental health symptoms, somebody's substance use symptoms. We assess for how any of those symptoms affect a person's life and what they would like to see happen as far as treatment and recovery. And therefore, we determine a diagnosis and a goal from that for treatment.
What about making these assessments available, as we say, same-day assessments? Why is that so vital in this industry? And I'm going to maybe guess here. If you have a pounding toothache, you call the dentist. I want to get seen right now. But a lot of times when you have an emotional issue, sometimes you have to get to that right spot. It's a process. My guess is we want to be sure when someone has reached that point, okay, I need help. The best time to get help is always right now. And my guess is that's one of the key factors in providing this.
Absolutely. That is exactly why we have worked so hard to be able to provide same-day assessments for those who need it, because those who experience mental health symptoms, substance use symptoms, as you said, it is very much accepted in society to seek help for a physical problem, but for a mental health issue, it is still very much a secondary issue. It's getting better, and we have definitely worked hard towards making it just as important as physical ailments. But as of right now, people take time, and it is a process for them, as you said, to get to the point where they are saying, okay, I'm going to reach out and get help for this. And it is vitally important that when somebody makes that decision, they can get in that day. If they take any more time, it may happen that they change their minds, or somebody says something that may make them think that, oh, it's not as important, or I'm going to be judged, or I can't do this. And therefore, having access to that first initial comprehensive assessment is very, very important.
Before we move on to the next point, you touched on stigma there, and I do feel that that's always something that's very relevant in what we do.
Absolutely.
How do you, when you're out socially or what have you, and someone raises the concerns of stigma about getting help, what is your answer to that? How do you address that concern?
That is a very good question. I try really hard to address it, first of all, by normalizing it, validating it and normalizing it. And that's something that we do often as counselors. We want our clients to believe and feel as well that what they are experiencing is not unusual. It's not abnormal in the sense that all people experience those symptoms. So if somebody comes up to me and they start talking to me about that is the first place where I start, is letting them know that is okay. It is very much valid feeling, a valid situation. And then I absolutely let them know what I do for a living and that there's help out there. And I have had those instances actually in the community where I was at different events and people would come and ask me, how do I get help? And I would just say, call me, or there are these other resources in the community, call one of them. And that's a great place to get started.
That's a great answer. Thank you so much. We offer a number of different things here at CommQuest in the way of service. What conditions specifically are the same-day assessments targeted for?
Our same-day assessments are targeted towards addressing mental health and substance use disorder symptoms primarily. We also are very mindful of the fact that there is an epidemic going on along with our current pandemic, and that is still related to opiate use in our community. And it is vitally important that we have access for those who are ready to seek help towards that. We have detox services, we have medication-assisted treatment services, and we, of course, have outpatient and residential services as well to address those symptoms and as well as the mental health symptoms. Often people who come to us for help need medication, and we do our best to get everybody in front of a psychiatric provider as soon as possible, as well as a counselor. Often, when clients come in, they also need case management services. They have a hard time managing daily tasks of attending doctor appointments, paying bills, things that most of us would think of as mundane. But for those who really struggle, those are mountains to be climbed. And it is very helpful to have a case manager to help along with that. We also offer supported employment services, and we do offer that to our clients right away or as soon as they're ready. We also try to connect them in the community if that is what their needs are.
Fantastic. Getting back to the example of going to a medical doctor, there are times when you call the doctor's office and they say, if you're experiencing an emergency, call 911. In this case, it's very important that obviously we have same-day assessments for those who need it, and that's a critical need. But when the needle goes into the red, when is an emergency room or something like that more appropriate?
Yes, those situations do happen. And if somebody comes to us in a state of psychosis or somebody's experiencing a lot of delusional thinking, if somebody's experiencing suicidal ideation or at times ideation of harming others, if somebody is in severe and active withdrawal, those would be the times that we recommend that they go to an ER or try to connect them to facilities that manage those symptoms and offer stabilization, such as the crisis center.
Very good. How long does an assessment take? And this is kind of a two-part question. My guess is there are days when you have a lot of people come forward and it's not possible to process them all. So what is the procedure for that? So that's your two-part question. How long does an assessment take? And what is your procedure for managing overflow?
Yes, that's a great question. So a comprehensive assessment takes 1 hour. However, before a comprehensive assessment can happen, we do ask that a client allow for 30 minutes also for just the nitty-gritty paperwork that is necessary to complete. And it's not that is not important, but obviously we want to focus on the comprehensive assessment. So we will complete paperwork that allows us to then do what is needed in the comprehensive assessment. So it takes about a total of an hour and a half. So currently, we do have blocks of time set aside each day for comprehensive assessments, and it is helpful if somebody comes during those times and the earliest possible, because we do operate on a first come, first serve basis.
Sure.
However, we do have a lot of openings, not just at our site. What we also have available is if somebody comes in and all of our assessment openings have been filled for that day, we are able to reach out to one of the other sites. We have 3 other outpatient sites and have the comprehensive assessment completed via telehealth. And that has been really helpful as well. Thus far, we've not had anyone whom we turned away for not having had somebody available to do a comprehensive assessment.
That is, wow, that's very good. You mentioned coming early in the day. That kind of seems like an obvious thing, but we do want to stress that the earlier that you come, there's more time in the day to get you through the system.
Yes.
Sure. The different locations have different times, slightly varying. So we would want to encourage people to call ahead and find out what location is best and what is the best time to come in. Is that correct?
Yes, that is absolutely correct. If they can call the 330-455-0374 number, that will be our main line, and they will be able to find out which site would serve their needs best and what the times are for those walk-in and same-day access assessments.
Greta, I want to thank you so much, first of all, for everything that you do. I can't speak highly enough of our staff, our provider staff here at CommQuest. You guys do incredible work. Thank you so much.
Thank you, Bill. Our counselors do amazing work.
Yes, they do. And I want to thank you for coming on the podcast and relaying some of this information to our audience. Again, for general information about our organization, I would encourage you to visit CommQuest.org. And that's CommQuest.org, CommQuest.org. And again, our general number is 330-455-0374. Greta, thank you very much for all that you do and for providing this information today.
You're very welcome, and thank you, Bill.
You've been listening to the Hope Discovered podcast by CommQuest. Thank you very much for listening, and we will talk to you again very soon.